All right, so here we're back to part 2 of the lymphatic drainage of the breasts. Okay, so now we're going to see how the breasts is going to drain its lymphatics into the venous circulation. Now, if you guys look at the parts of the breasts, you guys by now know that we have the nipple, we have the areola, we have the skin, we have the lobular, the mammary lobules, all right? And then we have septi between them, okay? And then they are all resting or sitting on the pectoralis major, okay? Now, the areola and the nipple are draining into a lymph node called the subareolar lymph node. So it's quite easy. Now we have another lymph nodes. They are sitting down to the skin and they are draining the skin of the breast, and we call them the subcutaneous lymph nodes. And then we have another groups of lymph nodes. They are sitting on the septi between the lobules of the mammary glands. So we call them the interlobular lymph nodes. They drain the gland itself. And then after all, we have a plexus. This plexus is actually running behind the mammary glands and before the pectoralis muscle. So we're going to call this plexus of lymph vessels the submammary, because sub means below, or prepectoral plexus, because pre means before. So the subareolar lymph nodes, the subcutaneous lymph nodes, and the interlobular lymph nodes from the mammary glands, they all bring their lymphatics all the way to the submammary or prepectoral plexus. All right, great. What happens afterwards? In order to understand what happens afterwards to these glands, let's have a look on the breast from anteriorly and see when we gather all the lymph nodes to the submammary plexus, what's going to happen. If you guys look at the breasts, we have lymph nodes superiorly around the clavicle, and these groups of lymph nodes here around the clavicle, we have supraclavicular and infraclavicular. They drain the lymphatics of the breast superiorly to the supra and infraclavicular lymph nodes. Laterally, we have the axillary lymph nodes, which drains 70% of the lymphatics of the breasts, which is very important. And we're going to talk about the axillary lymph nodes in a while. Now, when we talk about the medial part of the breasts, we have the medial part that drains by crossing over to the other side, and this is running with the internal thoracic vessels, the perforating branches of it, and that goes to the other side of the breast, and this is what we call the parasternal lymph nodes. And also we have part of the breast, which is the inner lower part of the breast. It drains through lymphatics running in the rectus sheath. Now, 70% of the breast tissue drains into the axillary lymph node, and we're going to talk about that. 20% of the lymphatics of the breast is going to cross the other side and drain into the axillary lymph nodes of the other breasts. Few amount is going to go to the clavicular, and few amount goes to the rectus sheath. And inside the rectus sheath, you guys know that we have the vessels that runs around the vessels of the epigastric vessels, and then the paraumbilical veins, and the paraumbilical veins takes those lymphatics through around the ligamentum teres, and that brings the lymphatics around the portal vein. And if that happens, it means cancer of breast or tumors can spread through this route, which is through the rectus sheath, the paraumbilical veins, around the ligamentum teres, around the portal vein into the liver. So this is a very dangerous route of spread of cancer cells. So what would you expect if you have an exam question asking you about which part of the breast is the most dangerous? It's actually the lower inner part of the breasts. Why? Because this is the part that can spread the lymphatics through the rectus sheath and all the way to the liver, and taking all these malignant tumors to the liver. Okay? Why it's important to know about the parasternal lymph nodes? Because if you have a patient in the clinic and you find that this patient is having cancer of breast and you are doing your clinical examination to the lymph nodes of the axilla, you guys need to make sure to do the same examination on the other side of the breast, because 20% of the lymphatics of the breast goes to the other side, to the other breast, so it can be spread to the other side. So you want to make sure that you check both sides in case that patient has spreaded the tumors to the other side. It means you need to treat both of them. All right. Now, this is where the submammary pectoral plexus drains its lymphatics from the whole breast. These are the groups of lymph nodes. Now, let's talk about the very important thing about the axillary lymph nodes, because the axillary lymph nodes are actually the most important ones, and 70% of the lymphatics are actually going to the axillary lymph nodes. For in order to understand the axillary lymph nodes, just think about your axilla. You have your axilla, right? The axilla is formed by pyramidal shaped a space, and you have on the top of the apex, your apex is at the top, your base is actually down. It's actually the axillary skin, the hairy skin of the armpit. Yeah, this is the base. Laterally, you have the humerus, and medially, you have the upper part of the chest wall, the first ribs. Yeah. Now, because this is actually the axilla, and because the humerus is laterally, so we call that group. Now we're talking about, you guys, the axillary lymph nodes. We want to see how the breast drains into the axillary lymph nodes and which groups of the axillary lymph nodes. Remember when we said that 70% of the lymphatics of the breast goes to the axillary? We want to see which group of axillary lymph nodes. So this is just a quick overview about the axillary lymph nodes. Now, this is the axilla. Because this is the apex, we have apical group of lymph nodes at the apex, which is around the clavicle and the scapula. Here, this is the apex. And this is because this is the base of the axilla, which is the armpit. All right. This is the basal group of lymph nodes. All right. And then you have anterior wall, you have lateral wall, and posterior wall. Because the posterior wall is actually your scapula, so we call it the subscapular group of lymph nodes, or posterior group of lymph nodes. Because your lateral wall is the humerus, we call it the lateral group or humeral group of lymph nodes. And because anteriorly, it's actually your pectoralis major muscle, the pectoral region, the pectus, all right? This is, we call it the anterior group of lymph nodes. Anteriorly, the anterior wall of the axilla is the anterior group. Now, what do you think drains the anterior group of lymph nodes? Of course, the breast. Remember when you said 70% of the breast drains into the axilla? It's actually the anterior group or pectoral group of lymph nodes, because these group of lymph nodes, they drain the anterior trunk all the way up until the umbilicus. So everything here drains into the anterior group. Lateral group actually drains the upper limb, because this is the humeral group. So what drains into this is actually the upper limb. And what drains posteriorly, it's basically your posterior trunk up until the iliac crest. But plus the axillary tail drains into the posterior group of lymph nodes. Now, why am I mentioning that? Because I want you guys to know that the breast drains into the pectoral group of lymph nodes, and it's common sense because the breast is sitting on the anterior trunk, so it's common sense that it drains into it. But why, again, I'm mentioning the other groups of lymph nodes? Because you guys, you can have a question in the exam asking you about which group of lymph nodes that would never be affected in breast cancer. It's definitely going to be the humeral, because it only receives lymphatics from the upper limbs. I think I had here an I inserted here a shape that is not showing. Anyway, now what happens, remember that we talked about the lymphatics of the breast. We talked about how all these groups, they empty into the submammary. Yeah. Now these submammary, they drain into different groups of lymph nodes. And now we're talking about the axillary lymph nodes, which is mainly the pectoral or the anterior group of lymph node. Yeah. And then some of it, which is regarding the axillary tail, drains into the posterior group. Now, what happens next to that? We want to bring these lymphatics to the venous circulation, right? So what happens? The anterior group drains into the basal group of lymph nodes, or the central group. We call it central because everyone drains into it. And from there, if you guys look at this lateral view, remember our clavipectoral fascia, and this is pectoralis minor muscle, all right? And here was the pectoralis major. Actually, the basal group is here at the axillary base, which is your armpit, yeah? And here, this is the apex of the axilla, remember? And above here, the supraclavicular, yeah? And here, this is the central part or pectoral part. So what basically happens is the anterior group drains into here, the basal part, and then from the basal or central group, it drains into the apical, and from the apical group, it drains into the supraclavicular, and from the supraclavicular, it drains into the, if we are on the left side, thoracic duct, and in the right side, it drains directly into the junction of the internal jugular vein and subclavian vein. You guys know what is the connection between the lymphatic system and the venous blood system. If you guys don't know, again, go ahead and watch the overview of lymphatic systems, lymphatic system of this channel. Okay, so after all, it gets to the supraclavicular, and from there, the lymphatics get into the venous blood. Why we need to know all of that? Because you guys, if you get a question or a patient that you know that supraclavicular lymph nodes are involved, you need to know that this case is very severe, and it means that the tumor is actually reaching the last stage of the lymph nodes. It means it's going to drain into the venous circulation, and there is a high tendency that this cancer can be spreaded by blood into other organs, the lungs, the brain, and any other organs of the body, and it's very severe case. So if you have a question about which one of the groups of lymph nodes, if it's involved in breast cancer, is going to be the most severe, it's actually the supraclavicular lymph nodes, because it means it has been spreaded all the way to the last destination. And if you can catch the patient and surgically remove the involved lymph nodes from the very early stages, it means that this is not very severe. So in that, the supraclavicular is going to be the most severe case. And we also have levels where we kind of classify the spread of the metastatic axillary lymph nodes, which are actually the level 1, level 2, level 3. Of course, level 1 means this is the best prognosis. Level 2 means severe. Level 3 means very, very highly severe case, of course, by numbers. And also, if you guys look at the levels, level 1 is actually, like we just mentioned in the previous slide, it's when the involvement is only at the basal group. Level 2, it's if the tumors are reaching the pectoral group behind the pectoralis minor. If it could reach up until the apical group at the apex above, it means it's very severe. It means that they are almost going all the way to the supraclavicular lymph nodes, and this is a very severe case. And these levels are actually classified based on the location of the axillary lymph nodes with respect to the pectoralis minor muscle. Okay, so remember all these important information in case you had any exam question. And the last thing is actually the innervation of the breast, and it's going to be very easy, because if you think about the breast is actually sitting on the pectoralis major muscle. So of course it's going to get innervation from the medial and lateral pectoral nerves, because it sits in the pectoralis, yeah? So medial and lateral pectoral nerves. Another thing, remember when we talked about the muscles, the surrounding muscles of the breast, we said that we have the serratus anterior. This is serratus anterior. So the long thoracic nerve, or nerve to serratus anterior, is actually giving innervation to the breast. Another thing, can you guys see the latissimus dorsi muscle? Okay, so the nerve that supplies the latissimus dorsi, which what we call the thoracodorsal or nerve to latissimus dorsi, it's going to give innervation to the breast. So you don't need to memorize them. You just need to remember the location of the breast, the surrounding structures, and they are donating innervation to the breast, sitting on top of them. Thank you guys for watching. Don't forget to like and subscribe, and see you in the next concept.